Hello everyone. Now let's discuss about the Norma occipitalis or the posterior view of the skull. So Norma occipitalis is convex upwards and on each side, and it is flattened below. Now what are the bones which we can see in this area? We can see the posterior part of two parietal bones from above and upper part of the squamous part of occipital bone below and the mastoid part of temporal bone on each side. This is your mastoid process, and so this is called as mastoid part of temporal bone. Now what are the sutures over here? This is your lambdoid suture which lies between the occipital bone and the two parietal bones. This is your lambda, the center point, and now this is your parieto-mastoid suture between the parietal bone and the mastoid part of temporal bone, and this is occipito-mastoid suture between the occipital bone and the mastoid part of temporal bone. And we can also see the posterior part of sagittal suture. Now lambda, parietal foramina, and sometimes oblivion can also be seen in the norma verticalis. Now external occipital protuberance. This is external occipital protuberance. It is the median prominence in the lower part of this norma. It marks the junction of head and neck. The most prominent point on this protuberance is called enion. What is enion? Enion is the most prominent point of on this protuberance, on this external occipital protuberance. Okay. Now there are superior nuchal lines and inferior nuchal lines. We can also see highest nuchal lines sometimes, which is situated above the uh, superior nuchal lines. These highest nuchal lines, these are not always present. They are curved bony ridges which are situated about 1 centimeter above the superior nuchal lines. These are curved. Okay, these are your highest nuchal lines, but these are not always present and they begin from the upper part of the external occipital protuberance, and these are more arched. Now superior nuchal lines, these are curved bony ridges passing laterally from the protuberance. These also mark the junction of head and neck, and the area between the superior nuchal lines, these will be studied in the uh, Norma basalis. Now There is a mastoid foramen, which is located on the mastoid part of the temporal bone or near the, or it can also be located at the occipitomastoid suture or near the occipitomastoid suture. This mastoid foramen, it transmits emissary vein and meningeal branch of occipital artery. Now this upper part of internal occipital protuberance, it gives origin to trapezius muscle, and the lower part gives attachment to the upper end of ligamentum nuchae, and the middle one third of the superior nuchal line gives origin to trapezius, and the lateral part provides attachment to the sternocleidomastoid above and splenius capitis below.